So, welcome to the first Culinary Medicine Interest Group podcast. With us, we have Dr. Craig Zalvan. He's going to be speaking to us about laryngopharyngeal reflux and plant-based diets. He's an ENT based in Westchester County, and I'll let him introduce himself.
So again, thanks for the introduction. And wow, I didn't realize I was the first, so I'm very honored. But this is a very important topic that I think, I want to say I'm really happy to see that the next generation of our physicians are embracing the obvious answer to many of our chronic diseases, which is through a diet-based approach. And so it really is an honor and privilege to be here. So yes, I am an ears, nose, and throat, but I'm a laryngologist. I specialize in voice and swallowing disorders. And as such, many of my patients have reflux, which is the primary cause and or a contributing factor to a lot of their throat-related problems. And I am in Westchester. I'm the chief of otolaryngology and the medical director of the Institute for Voice and Swallowing Disorders at Phelps Hospital. And I'm also one of the physician members of ENT and Allergy Associates, of which I'm part of the Voice and Swallowing Division. So what I'd like to first start with is just really define what laryngopharyngeal reflux, or LPR, is. And this is an important disease because it affects a lot of our patients that come in with multiple throat complaints. So we all know what reflux is. Well, at least we think we do. And typically when somebody hears the word reflux, they think of heartburn and indigestion and abdominal discomfort and bloating and early satiety. Well, that's true. That's GERD, gastroesophageal reflux. But what I take care of is laryngopharyngeal reflux, and we'll just say LPR. It's a lot easier. And LPR is a constellation of symptoms that include throat clearing, feeling of a lump in our throats. And you know, many of your friends or classmates, and you can hear them in the classroom doing that all the time. Chronic coughing, which is obviously very important in this COVID era. Also changes in voice. Not that reflux causes voice problems. I'm not a believer in that, but I do think reflux can make a voice issue worse. Obviously, we need to look for the other cause. It can also contribute to swallowing issues and burning, sour, acid taste sensation in the throat. Now, you can see all these symptoms I just mentioned could also be part of other diseases, and that's why this disease is often confused with allergies and viral infections and asthma and other disorders that can affect the head and neck. So reflux disease, or LPR, is a very common presentation, certainly in my practice as a subspecialist dealing with voice and swallowing disorders. And I think it's important to realize that a lot of visits to physicians are with the head and neck issues, especially many of these symptoms. That's sort of the overview of what LPR is. And I think as we get into some of the questions, we'll kind of understand the treatment of LPR.
Thank you for the introduction. So I think we'll start off just by asking what are the typical triggers of LPR with specific emphasis on diet? And then as you go into them, maybe talking about what foods should be avoided after a diagnosis and what foods may be beneficial to incorporate more into the diet.
Sure. So, it's always an interesting question, and everybody wants to know what things trigger reflux disease. And again, I'm going to talk primarily about LPR. That's my area of expertise, but certainly reflux disease is a spectrum, GERD and LPR, and not everybody has to have both. In fact, most people don't have both. You can have reflux that affects the throat without affecting the esophagus, which is well protected against acid and digestive enzyme pepsin. So what are the triggers? Well, I think that's a great question. And, most people have heard of coffee, tea, chocolate, soda, greasy food, fried food, fatty food, spicy food, alcohol. These, I believe, do not cause reflux disease. They trigger reflux disease. They exacerbate an underlying problem that exists. They may make the situation worse. And truthfully, a person who's well treated or has had a resolution of their reflux disease can have many of these foods and liquids without much, issue, although there are other health reasons not to have some of them. But certainly, I believe these are the triggers. What I believe is the fundamental cause of reflux disease is the diet itself. It's what we eat. In our westernized societies, we eat a high animal-based diet, and it's the relative amount of protein that's in our diet that is the primary responsibility for the onset and propagation of reflux disease, as well as many of our other chronic diseases in society. So, sort of in a roundabout way, starting with the treatment, I can get into the why we got here, which I think is important. And I've been treating people with LPR now for, I can say, almost 2 decades. And as a laryngologist, I certainly have had a huge volume of patients coming with these voice and swallowing issues. And early on in my career, for the first 10 to so years, I would treat with what was the standard treatment for reflux, which is PPI therapy. And I think this kind of parallels much of our patient population for all chronic disease. People come to the doctor, they expect a prescription for a pill to take for their problem. Doctors, on the other hand, need to write a prescription so that they can get the patients out faster, that they don't have to spend as much time, and it's certainly much easier to give a pill. And in many cases, and again, this is broadly speaking for all our chronic diseases, pills help. They do suppress symptoms, but in many cases, they don't reverse disease. And so after giving years and years of treatment, I give a PPI. Well, you didn't get better, so we give 2 PPIs, and that doesn't work, you change it. Oh, still not better, add on an H2 blocker. And this becomes sort of the paradigm that many of us use throughout all of our medical fields. And I kind of just got very frustrated. It didn't seem logical to me that we've evolved to be on pills for the rest of our lives. So in my mind, I thought there's got to be a better way to treat these patient populations. And so what I did is I actually looked into the chronic disease literature. And believe it or not, there's a wealth of information that's out there. We just don't hear it. It's not as sexy as the latest stent or the new surgical procedure and the new $100,000 a year drug. And what I came across is a book, The China Study, written by T. Colin Campbell. And Colin is a fascinating man. He's very educated, highly decorated, has done so much to sort of propagate this whole concept of plant-based diet. And the premise of his book is we're sick with heart disease, diabetes, stroke, and cancer because of our high animal protein diets. So I'm thinking if all those diseases are caused by these Americanized, westernized, high protein diets, then reflux, which is also a chronic disease, is going to be caused by the same thing. And that's when I started really looking into the literature. And again, a wealth of information out there. And we know that the more animal-based the diet is, the higher the likelihood of heart disease, diabetes, stroke, and cancer. And there are studies there with 500,000 people, such as the NIH AARP study or the EPIC study out of Europe, the Seventh-day Adventist study, the Nurses' Health study. And if you look at the data, they all clearly, repeatedly say the same thing. The more plant-based diet, the less likelihood you'll have severity of disease, onset of disease, propagation of disease, morbidity and mortality from the disease. Now, there's lots of debates about how plant-based, how animal-based, where's the right amount, and obviously we're all different, so that's certainly got to be some degree of fluctuation. But I think it's clear the more plant-based you are, the less likely you're going to have these diseases. And so the same holds true for reflux disease. And what we did is I looked at my data together with Dr. Jan Galipter and Dr. Raj Tiwari, and at the time, one of our medical students, Shirley Hugh. And we looked at our data after switching patients over. So what I did is for years after I started tapering off PPIs, I was once one of the largest prescribers of PPIs in the region. And then I started saying, let's try something different. And we put our patients on this Mediterranean style diet. And what I tell my patients, it's 90 to 95%, preferably 95%, plant-based Mediterranean style diet of fruits, vegetables, grains, and nuts with no discrimination, and the standard precautions of the coffee, tea, chocolate, sodas, and the rest of the list. And we said, let's see how you do, looking at symptoms. And then we look back at our data, and what we found is that, and our data was published in JAMA Otolaryngology, was that people responded as well, if not better, on the diet-based approach without PPIs. And if you look at the subcategories such as voice issues or cough and dysphagia, they actually did better using a diet-based approach. So what this said is that you can get the same results of symptom resolution without an expensive and potentially dangerous pill. And there has certainly been a lot of literature showing there are potential risks of being on PPIs for both the short and long term. Things like pneumonia and GI infections and possible bone disease. And there's also been a lot of literature about potential risk of long-term use and heart issues, kidney, liver, increased risks of cancers, and even including Barrett's, which is what PPIs are used to treat. So it became very clear to me that reflux should be treated with a diet-based approach and not these drugs. And now, as one of the former large prescribers of this medication, much to the chagrin of the pharmaceutical companies, I hardly ever prescribe these medications. They're useful. They're great drugs. They don't stop reflux. They don't treat reflux. What they do is suppress acid. People still reflux. And reflux disease is really an issue of a combination of acid, digestive enzyme pepsin, which can cause damage, especially to the laryngopharyngeal tissues, as well as sensitivity changes that can occur as well. So I think in a roundabout way, I think I've answered the question. The way that I treat is with a primarily Mediterranean-style plant-based diet, avoid the typical triggers. I also use other adjuncts such as topical alginates, which coat the throat and the esophagus and are safe to use as sort of breakthrough for symptoms and also means to wean people off PPIs.
So I have a follow-up question for you. You put your patients on like a 90 to 95% plant-based Mediterranean diet, but how did you kind of like monitor what they were eating? And I'm sure for a lot of them, that was a very new way to be eating. And so how did you kind of teach them to want to eat that way and like how to feed themselves that way?
That's a great question. I think that's probably the most important question that will ever be asked is how do we get our patients to listen to us? Because compliance is always an issue. Forget about diet, but even just taking drugs and medications, and certainly dietary and lifestyle behaviors are really difficult to have people listen and follow. And so what I guess it goes with time. So a decade ago, if you'd asked me this question, I'd say, yeah, it's tough. You know, I tell people that they need to be plant-based or vegan, and we don't like to use the word vegan anymore. It sort of has the negative connotation. I really do like plant-based. I think it makes more sense. And I'd tell people, you need to be on this plant-based diet and you're going to fix yourself. And they look at me like, what are you, crazy? You have I got 3 heads. You know, chicken's good for me. I need my steak. I have to have it. And that's because we've literally been brainwashed over the last 50 years to think that it's protein, 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 and we need this protein in order to be healthy. And that couldn't be further from the truth. Now, though, when I tell a patient this, I get the standard, yeah, I know. And it's quite common now for people to say, well, it's in the news all the time about plant-based diets. We see numerous trends. It's the celebrities. It's all the health craze that's out there. And clearly people are moving towards a plant-based diet. So what I think it's more easily acceptable now, it still can be a challenge. And what I do is I provide a lot of guidance for my patients. I spend a lot of time talking about diet, which is something that most physicians don't do. I provide a lot of literature and guidance. There's a lot written out there, and there's many books that can be read. And what I find is if you try to get a patient to educate themselves more, the more they learn, the more they want to be closer to that 95% or even better. And I think that's the only way that you can make somebody change a behavior is to educate them about it. But more importantly, get them to educate themselves, a little sort of self buy-in. And I find that although it's still a challenge at times, most people are certainly willing to make significant changes. And it doesn't take much. A little change, you notice effects right away. And it's not just with reflux disease. A lot of their other diseases get better too.
Thank you. It's very, very insightful. I want to touch on something that you've kind of hit a couple different times in different ways, but you mentioned multiple times that the Western Americanized diet is very animal protein based. And you were just talking about how to educate patients to understand the importance of a plant-based diet. And I wanted you to touch on how you break through the wall of people thinking they need so much protein from animals, so much more than they actually do.
Right. Well, again, I think there was a lot of work done in the 50s and 60s to try to feed the world. And, growing animals is pretty easy to do. It's cheap to do. And everybody thought that that would be the cure. And, if you look back at the early food pyramids, it's protein, 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 protein. Oh, yeah, a little bit fruits, grains, and other things. And, again, over the years, certainly with work by Colin Campbell and, many others out there, we realize that that's really not the case. And in fact, most of our chronic diseases are due to the high protein content. When you look at what we need as protein, humans need about 0.8 grams per kilo per day of protein. That amounts to about 50 to 60 grams of protein a day for female versus male. And Americans eat far over 100, 110 as an average, with some Americans eating over 200 grams of protein a day. So our bodies don't need that much protein for them to make muscle and repair muscle and to the other, uses of our amino acids. We get more than enough. And the thought is that plants don't have protein, which couldn't be further from the truth. All food materials have amino acids. They all have proteins. What matters is the bioavailability of those amino acids, the relative concentration, and also the amounts. And eating animals certainly will give you a high amount of protein, which is very bioavailable. But the problem is the excess. So when there's too much amino acids, we don't absorb them all. And the excess that we do absorb doesn't all get changed into muscle. There's fat, there's carbohydrates, and that's what happens with the excess. But the majority of that excess ends up going into the colon, where it becomes food for the microbiome. And there's very different microbiomes depending on whether or not you're an animal-based diet or a plant-based diet. And there's clear evidence showing that those that are animal-based, that excess protein is turned into a number of different chemical mediators, such as trimethylamine, which is a chemical mediator of inflammation, thought to be one of the causes of heart disease, not as much as cholesterol, which we all think, but it's an inflammatory process. We see increased production of IL-1, which is a promoter. So too much protein leads to an imbalance leading more towards inflammation. And plant-based protein is more than enough. And what's interesting is that the concept of why does this help with reflux? Well, animal-based protein, highly bioavailable. By the time you chew a chunk of steak, it goes to your stomach. You're already digesting it. You're having amino acids, which then go and increase the amount of gastrin that's released. Gastrin is the hormone that promotes acid release and pepsin release. More acid, more pepsin, more breakdown, and it's a vicious cycle where we're increasing gastrin and pepsin, and acid. And that's why protein makes such a problem with reflux disease. If you have a lot of plant-based protein, that's not as bioavailable, and a lot of that digestion is further on in the intestines. So you're bypassing that positive feedback. And there are clearly studies that show that given people high protein diet versus high plant diet, or animal versus plant diet, you see significant changes in the amount of gastrin that's secreted, the amount of acid and acid exposure time, and the amount of pepsin. So we know that by limiting the protein that you're eating in form of animal, you're decreasing your acid exposure. And also, again, multiple other factors that you're going to decrease that are less inflammatory. I hope that answers that question.
Very much, yes. You've answered all of our questions without us even asking them.
Okay.
So One of the last things I want to ask you is about how to get this into education, how to make nutrition and diet an important part of medical education, because it is becoming more prevalent as a treatment option. As you've mentioned, you went from being the number one prescriber of PPIs now to the number one prescriber of plant-based diets. And we wanted you to touch on your feelings of the importance of making sure that this information is hit hard and heavy in medical school so that people like us can understand more about how diet can be so impactful without having to go straight to pharmaceuticals.
Well, you guys are doing it, and that's the bottom line. It's about education, it's about interest, it's about learning, reading. I mean, look, we need to do more than just help ourselves and our patient populations. We need to help the environment. And, this plant-based approach, although it's not the cure for everything, of course, it certainly is going to push us in a far better direction to better health, better environment, far less cost. And if you think about the number of people that are on drugs or having surgeries for heart disease and diabetes, I mean, type 2 diabetes is really a disease that shouldn't exist to a particular degree. I mean, of course, there are some reasons why people will have that problem, but the vast majority shouldn't. Same thing with a lot of coronary disease. These are diseases that technically we could reverse and stop, saving ourselves trillions of dollars on costs for medications, surgeries, morbidity for patients, and mortality as well. And it's taking people like you and their interest to get the word out. And the more interest there is, the more you can demand lectures and courses on the topics. Reading is fundamental. I've heard that before, but it's true. And if you want to learn and you want to get changes, you need to educate yourself so that you can educate your professors and people making decisions on what curriculum is presented. And we see it now more. Medical schools now across the country are now starting to incorporate more plant-based type studies in education, though incremental changes. And you have to read more. And there's great resources for yourselves, for patients, online, Forks Over Knives, the book How Not to Die, T. Colin Campbell's work, Estelin's work, all these books, all this information online. I'll do a little plug. Here's my book, Laryngopharyngeal and Gastroesophageal Reflux. And what's unique about this book is we cover GERD, LPR, and dietary approach using a more plant-based approach. So it's education, which is really key to making these changes in the curriculum so that we can make changes with how we treat our patient populations and save the environment.
Thank you so much for that answer. I know we both couldn't agree with you more. And we're so excited that you have been here today and been a part of our education. And we just want to end with one final question. Do you have a favorite recipe, either of your own or something that you like to talk about with your patients, related to reflux or not?
Yeah, well, I have a lot of favorites. My wife and I do a lot of cooking. She's primarily cooking and, a phenomenal chef, I have to say. And, we do a lot of sort of Indian type foods, dals, and a lot of the Asian foods. I love everything that, tofu, soy-based foods, which are very healthy for you. And, anything with fruits and vegetables, I love. There's a recipe, there's the king oyster mushrooms. And if you saute them with just a tiny bit of oil, I don't like to use too much oil. They're delicious and, a great texture. And so it's a dish that one of my favorites. But frankly, really, there's just so much that I enjoy. It's interesting, too, because I find that I've not been plant-based my whole life. I'm probably about 98.6% plant-based. And, the way I tell my patients is you be plant-based most of the time and you cheat a couple times a week, couple ounces, 2-3 ounces of any kind of meat. And I also think that meat is chicken, fish, eggs, pork, steak. I don't differentiate. I don't think any one of those is any more healthy for you than the other. Though, of course, there's a lot of debate about that in literature. But a little cheating here and there fine. And when I do cheat, it tends to be more with fish if I am cheating. But again, the variety of foods that are out there, the taste, the flavors, I just, I find plant-based eating far more interesting than eating a slab of some animal.
Well, thank you very much, Dr. Zalvan, for being with us today. All of your answers were very insightful, and it's a great way to kick off our podcast.
All right. Well, it's been a pleasure. And again, I'm honored to be the first. And I hope of many, because I really think you guys are doing a wonderful job of getting this information out there. And certainly, I think you'll make the biggest difference in healthcare through this education and your training. And I thank you for your efforts.
Thank you.